It's time now for the award-winning #1 local talk show in Northeast Pennsylvania, The Sam Lesante Show. Now here's your host, Sam Lesante.
Hey folks, how important is your heart to you? You want to take care of this little ticker, don't you? Yeah, and it's important that you keep it in good shape. Well, there's things that sometimes you got to do to keep your heart healthy, and some tests we have to take, and to make sure that we're on the right path. That journey that we're taking. Today we have from the Lehigh Valley Health Network, no stranger to northeastern Pennsylvania, Dr. Stephen Wolk, who is a cardiologist, and we're going to talk about interesting things about the heart. And some things that we should all know about. We're going to give you a phone number up in the screen once in a while, so you know if you want to call and ask any questions. I think it's important. Well, Doctor, how are you?
Very good, thanks, Sam.
Well, thanks for coming on the show.
You're welcome.
Leanne brings a lot of interesting doctors and people on the show to inform our viewers as to what's available to them. Tell me a little bit about yourself, Doc.
Been in the Hazleton area for 25 years almost, and completed my training in 1991. So I've been in practice for a fair amount of years now.
When you were, why did you decide to go, first of all, to become a doctor? What was the reason you became a doctor?
I think I was interested in trying to give people information about their health, also to help people who are ill get back to a better state of equilibrium.
Now, did you start off wanting to be a cardiologist?
I started off in actually family practice.
Okay.
And as things developed, I went into internal medicine and then into subspecialty for cardiology.
What steered you in that direction?
I think it was the type of mentors that I had that gave me information that I was looking for.
So going back, how many years have you been in cardiology?
Since 1991.
Okay, so going back to 1991, okay, and looking at the current year, okay, you certainly have seen a number of changes happening in the care of the heart or detecting some things. Okay, what are some of the biggest things that you have seen since 1991? If you have to rewind, okay, versus what we have today available to us.
Testing. I think there's such a profusion of studies today that this makes the possibilities much more beneficial for patients, for their health. So
in terms of technology?
That's correct, yeah.
Okay. All right, so when should a person, or first of all, let's talk about echocardiograms. Sure. Okay, I had one, so I'm familiar with it. What is an echocardiogram?
It's the use of sound waves to image the heart.
And what does that do?
And what we can do is collect different types of modalities, as we call them, different ways of imaging the heart with the use of sound waves, and give and obtain basically information about how best to treat patients.
All right, so what kind of heart conditions can an echocardiogram detect?
Almost all forms of cardiac disease give a signature from a sound wave standpoint, whether it be from coronary disease or the effects of it, hypertension, even diabetes, in different types of infiltrative diseases of the heart, especially valvular disease, another category, and I think that's a big category today for the population that we see.
What's that?
Valvular heart disease, and things like different narrowing of the heart valves, what we call stenosis, or maybe the heart valves are leaky. We can image openings in walls of the heart.
Now, When does one person know that they should have a echocardiogram?
Okay. Usually the physicians will suggest that to a patient, and we have a great group of colleagues here in the Hazleton area that will steer the patients in that direction. And the nice thing about it, I think, Sam, is that we can do these type of studies right here in Hazleton. We don't have to have people going outside of the area to have many of these studies done, and that also facilitates care if patients have to go to a larger center, for instance, like Lehigh Valley, to have studies done.
So when you're finding, let's take a percentage factor. So when you're doing echocardiograms, and there's a reason, I guess, why a physician would send them. But let's say I'm at home, and I don't go for my yearly physicals, and I feel good. Okay, what would be some of the telltale signs that should get me to at least consider going for a physical exam? Particularly if I'm having some concerns with my body.
The typical cardiac symptoms are chest pain, shortness of breath, irregular heartbeats or rapid, slow heartbeats, dizziness, swelling of the feet, feeling like a person is going to faint. We call that syncope. So these would be some of the I think main symptoms that cardiologists deal with on a regular basis.
So of the things that you mentioned, okay, because first of all, you're looking at a big baby here, okay? When I went for my echocardiogram, I was like a nervous wreck. I have no reason why, like a colonoscopy, they're a piece of cake. But because I'm a big baby, you're always worried. What if they find this? What if they find that? Of the things that you mentioned, are they treatable?
The symptoms are going to point us in one direction or another, and then the physicians are going to, again, recommend certain types of tests, and depending on what they find, this can make a big difference in the care.
Okay. So basically, I know you don't have a magic wand, but however, if you're detecting something, okay, from that, and let's say a person is getting a little dizzy, a little shortness of breath, a couple pains in the chest, and they go to the doctor, he says, look, I suggest we get an echocardiogram just to find out what's going on. Of the cases that you've had, okay, what are a percentage of people that have been able to, get along with their lives?
Almost all of them.
Yeah.
Almost everyone. The test itself, like all tests, will tell the physicians what they can recommend, but in and of themselves, the tests do not seal someone's fate.
Well, yeah, and I understand it. And here again, for those people that, I think early detection is always the best.
Absolutely.
I mean, there's no question about that. But me, I always have a fear of, what are they going to find type of thing. Okay, that's just my nature. But thank God, you got to get it done. The thing would be is, well, now what happens if they find this? Okay, well, there are either medications or, unless it's a severe thing, okay, then there's surgeries, etc. And I've known many people who had surgeries, and thank God, like you said, almost all of them. But there's always that doubt, how do we get that person to be healthy, okay? Folks, I'm talking to Dr. Stephen Wolk, no stranger to northeastern Pennsylvania. He's at the Health and Wellness Center. His phone number is 570-501-6580. Now, the point is this, if you don't feel well and you're having some concerns, pick up the phone and call, and they'll give you advice. I mean, if instead of, maybe I have some things happening, and you could say, well, look, based on this, maybe you should go and see your family physician, or if they don't have any, certainly they will do that. We'll be back right after this. Welcome back to the Sam Lesante Show, folks. We're talking about health care, and Lehigh Valley Health Network is certainly raising the bar every day. Remember, all of our shows you can see at 24/7 on ssptv.com. Now, that's every show we produce. All these health shows we have, they're all on the website. and want to say hi to many of my friends throughout the United States who have been sending me emails, enjoying all the shows. We appreciate that. My guest today is Dr. Stephen Wolk, and he is a cardiologist. He's been around for a long time in Hazleton, the greater Hazleton area, and we're talking about echocardiograms. All right, so person, calls you and says, look, I think I'm experiencing this or whatever it may be, and whomever says, well, this is what I recommend you do. And so they come now, okay, so now I'm told that I have to have an echocardiogram, okay, just to find out what's going on. So what do I have to do to prepare for this test?
Absolutely no prescription. It's a matter of showing up for the test. The patient's on the bed, and the ultrasonographer, what we otherwise call the techs, will set the patient up and put the transducer, which is completely painless, on the chest and take some pictures.
Folks, I had one, so I'm going to tell you it's nothing, okay? But I want you to answer the questions. How long does an echocardiogram test take?
Usually about 30 to 45 minutes, and the length in and of itself doesn't mean there's something wrong. Sometimes the patients just need to get a better picture. Yeah.
And that's what happened. When I was there, of course I'm apprehensive, but it was a piece of cake. Lay down. The girl who did it was absolutely fabulous.
They're fantastic.
Oh, they're great, and they
really have a good group of
people
there.
They did the test, etc. And I'm thinking, oh God, what are they going to find? I hope it's nothing serious, but that's because I'm a wacko when it comes to stuff like that. But it really is a great test.
It's a great test. It has revolutionized a lot of cardiology today, and was probably very much like echocardiography was back in the 60s and 70s.
Okay, so now to go back to my original conversation with you in the beginning. Now there you go. You have your echocardiogram machine right there, the technology. What did you do back in '93, '94? What did you have there?
Pretty much what we were doing even today, even though it's supplanted by this technology, and a lot of the technologies, we're listening to what the patient's saying. We're examining the patient, and so that means listening to their heart. We call it auscultation with a stethoscope, and trying to make a picture how best to fit all these pieces of information together so that we can come up with a plan about what's the best way to get that person back into the swing of things.
Now, are you present when they're doing the echocardiogram, or do you read the results?
Most of the time, I would say 99% of the time, the cardiologists are not present for the study.
Okay.
And
so, go ahead, I'm sorry.
No, that's okay, go ahead.
So then, when the pictures are done, then you're able to look and decide, okay? And now, the trained eye, okay, is always the concern with me, okay, because sometimes you pay for a professional who's been around a long time. It can save you a lot of time, and he'll be able to detect. And I'm going to tell you, we have great cardiologists in the town.
Okay?
Thank you. Seriously.
They are.
Yeah, and there's fantastic.
Everyone I work with here.
What happens then is, now your experience, okay, can you detect, or have you are able to detect something a little bit better than what it would have been when you were in '93 or '94?
I think the difference between '93, '94, as you say, Sam, and presently is that this type of test gives us a dimension that we did not have back at that time. And even the use of the technology is completely different. Things that we have now, we did not have in '93 or '94, even with the study. So it's constantly evolving.
Yeah, so a lot of the guesswork is taken out.
Yes, I think there is. You could look at it that way.
Yeah, because back then, I mean, you had to, well, listen, to play it safe, we should do this, okay? And not that you were saying something wrong, but to play it safe, But now we can play it safe to a considerable
certain degree. Yep.
Yeah. Am I correct in saying that?
I think you are. Yep.
Okay. So when you get this echocardiogram, okay, and you read it, and with the experience that you have, what would be, first of all, why would we touched on this before, but why would a doctor recommend an echocardiogram?
It would be for certain types of symptoms and conditions the patient is having, possibly even to follow what a known disease is with the patient.
Mm-hmm. All right, so now, what kind of follow-up test can be done if an echocardiogram detects a positive issue?
If there's something that the cardiologist feels should be followed, it may be nothing more than a yearly echocardiogram, or a blood test, or maybe a new study. Could be a cardiac catheterization, and it may be nothing at all. So,
But I've noticed, many doctors, many good doctors, once in a while you slip one in there that, it's a rotten apple you gotta get rid of, will recommend the test always to make sure that they're playing it safe with the person, okay? Am I correct?
that's, I think, right on the mark. And actually, the American College of Cardiology, American Society of Echocardiography have guidelines about when these studies should be used.
Okay, so just because you detect an issue, it could be something that could be treated either medically or whatever, like you said. It could be something that if a person has a certain symptom and the echocardiogram affirms that, okay? Now the doctor says, okay, now we know what you have, now start taking these pills every month, okay?
Right.
All right. But I mean, it all depends on what degree. I think if somebody has a serious problem, the doctor at that point in time wouldn't send them to you. If there was a real serious problem, they'd send them right to Lehigh Valley.
They would.
Yeah.
Right.
I mean, so getting a test is just a matter of getting the test. Now, the echocardiogram test, okay, it could be performed where in Hazleton?
It's at the Wellness Center and also at the hospital.
We talk about Lehigh Valley Health Network and how great they're doing. I mean, it's a great organization. We're very fortunate, really.
I think so.
I mean, at first people think you're losing identity. Really, you're not. You're gaining. I mean, I talk to doctors in the system now. We were talking a little bit before the show, where there are some doctors that joined the Lehigh Valley group, family physicians, and the network. Like for example, when you're done with your echocardiogram, okay, my doctor, anybody, if I have to go specific doctors, they know exactly because it's a computer system, correct?
That's exactly right, yes.
And so that expedites a lot.
It makes care much easier.
Yeah.
Yes.
So I mean, if I go to Benyo and if I or whatever, or if I have to go to another, they all in the system, they all know exactly what the results were, what to treat, et cetera, et cetera. Do you ever do any consultations with doctors? I mean, that after you've done an echocardiogram and.
A lot of times I'll give a physician a call and say, we did a study, found this, and suggest other measures, whatever they may be.
And when I did mine, you called Dr. Benyo and says, this guy has no heart. I'm talking to Dr. Stephen Wolk, folks, a cardiologist at the Lehigh Valley Health Network. He's up at the Wellness Center. Now, I'm going to give you his number. If you have any concerns, just call. So, you don't have to make an appointment if you have any concerns. They're here to help you. We'll be back. But here's the number, 570-501-6580. Folks, I had an echocardiogram. Okay, I'm telling you, it's a piece of cake, and thank God, like I said, they said, does Sammy really have a heart? No, it worked out pretty well. We're still doing some things, but we'll be back right after this. Welcome back, folks, to the Sam Lesante Show. Hope you're learning something on these health shows. My email is sam@ssptv.com, and thanks once again for the great response we're having to the programs we have here in Hazleton. Now, with me today is Dr. Stephen Wolk, who is an echocardiologist. Cardiologist, I'll get it right, okay, who does echocardiograms, all right? So once again, what's an echocardiogram?
It's a study that utilizes sound waves to image the heart.
Piece of cake. Test.
Easy. Yep.
You don't have to prepare for it.
Nothing. Just show up.
Just show up. Some of the symptoms, if I'm home and really if I have not been going to the doctor because I feel good and, I don't need the doctor, et cetera, because believe me, my father was one. He didn't believe in doctors, and God forbid he died from a massive heart attack. So, I don't know if he would have gone, what would have been the case, but the point was back in '87. You don't know, but the thing is, we don't want those things to happen, okay? Right. So if you have a symptom, first of all, what would be some of those symptoms?
Major symptoms include chest pain, shortness of breath, irregular heartbeats, either slow or fast. They can be signs of cardiac disease, patients feeling dizzy, possibly they feel as if they're going to pass out, and certainly unexplained swelling in the lower extremities.
All right, now at the Health and Wellness Center, yes, there are other cardiology services, okay? What are there?
You have Holter monitoring, obviously electrocardiograms. You can do nuclear stress testing as an outpatient. And we also do exercise testing there too, regular exercise.
Yeah, and when I was there, I've seen a lot of those people, doing that exercise. There's a lot of interesting tests, but here again, we have the facility, we have the technology, we have the availability to us. You like what you're doing?
I think it's getting more interesting every day.
Are you learning too?
All the time. I don't think it's a process where you say, okay, I'm at the point now where I don't have to do anything. You don't have to read. You always have to kind of keep up on new developments.
When you look at the human body itself, okay, God created a beautiful thing, but the body sometimes, it heals itself to a degree if it's giving some help in some areas. So when you're looking at the heart, there's the entire thing of the heart. What more can someone learn when that's the heart? You got valves, you have veins, you have this, etc. Okay, but it's interesting how you can learn more from that. From what the tests they do.
Right. The echocardiogram gives you another dimension in using the information in a way that can benefit the patient, whether it's by looking at how the heart contracts, what the valves are doing, how thick the walls are there changes in the flow. Mm-hmm.
I look at open heart surgery going back into the 80s, okay, and where it is today. Not that it's not because it's a piece of cake, but I mean the point is they've come so far, with open heart surgery that it's just amazing, what these doctors are doing. Some of them are going in and out in the next 2 days. Yeah. So I guess probably as that technology is increasing, okay, and now do you have to go to school or do you learn anything, or is there advanced studying that you have to do every year?
You do have to keep up a certain amount of what they call continuing medical education, and other than that, I don't think people will be doing anything other than following what the developments are in the literature.
Mm-hmm. So interesting enough, 25 years, you've been in the business, in healthcare, and I always like to talk to people who, like for example, if you ask me when I started with this 94 versus it is now, we got high definition cameras, sure, et cetera, and things have progressed, and that's what I think is so exciting with the network, the Lehigh Valley Network, is all this knowledge is coming in from all areas, so you can consult with a person,
that's exactly right,
Allentown, or I found, so there's always, you're always on the top shelf.
You always have someone there who you can ask, what do you think about this?
Yeah, and then through the network they could see exactly what it is. So it's great healthcare. Well, I wish you the best. Thanks for coming on the show.
You're welcome.
I hope you don't see me. But if you
Absolutely.
do,
I'll
you know,
wait.
I'm sure you'll take excellent care. But I'll tell you, I had the echocardiogram, as I said before. It was a piece of cake. It really was. And the people they make you feel so relaxed, etc. Because I was a nervous wreck. I think the girl says, you know, because I'm a baby. I said, I'm a baby. Dr. Stephen Wolk, folks. You can contact him at 570-501-6580. Any symptoms whatsoever, just pick up the phone and call. You know, I'm experiencing this and maybe nothing. It's better to get it done now because I'd like you to stick around and watch the Sam Lesante Show and our news. Any questions, again, please give him a call. We'll see you next time.